Hey everybody, happy Global CE Day. Tom Judd here from CED with Frank Rothe from Germany, and he's going to tell more about himself and pronounce his name correctly. Hey Frank, how you doing?
Hey Tom, how are you? Great to be here. Correct pronunciation is Frank Rothe. Very German, isn't it?
Well, I have some German ancestry, but I still had no chance, Frank, of getting that right. But so you were just saying you got a daughter in university and a son that's a clinical engineer? Oh my gosh.
Yeah. Yes, I'm very proud of them. They're doing very well, and so I think can continue to concentrate on my work because they are standing on their own feet, and yeah, that's what makes a father proud, isn't it?
You bet, you bet. So tell us about your role now and maybe in recent years. So what are you doing in the field these days?
Uh, I'm working as head of the technology management department of VAMIT Europe. I'm leading it, so it contains, we're responsible for, yes, our major responsibility is medical devices, HTM, health technology management, but we are also taking care for facility management and central sterilization units in hospitals. So this is a framework. Yeah, we are present all over Western Europe, I would say. Yeah, in more or less that's 500 hospitals.
Oh my gosh.
Our major focus is still Germany, where we are responsible in 300 hospitals. In the major part is HTM. And yeah, I can give you some figures. It's the asset value we are responsible for just in HTM all over Europe is approximately 5 billion euros purchase value, and yeah, it's round about 800,000 assets.
So Frank, how long have you been with the organization that you now lead, and where are you physically located? I mean, probably out of home during COVID, but.
Yeah. Our offices are located in Berlin.
Okay.
So yeah, VAMIT is an Austrian company, but VAMIT Germany takes care for the western part of Europe. Yes, as I already mentioned, we are located in Berlin, but usually it's not the major part of our staff that is located in Berlin, because we have the philosophy that we do not tele repair devices, but we have engineers and technicians and also purchase experts in the hospitals taking care on site. So this is our philosophy, not to do it.
You must have a very large team.
Yeah, just in HTM, we are talking about 600.
Oh my gosh.
Yeah.
Well, we at Kaiser Permanente, you know, in the U.S. Had about 500 in our national department spread across several, you know, parts of our country. But hey, you're bigger.
Yeah.
So that's cool.
That means.
but then our friends, you know, actually a similar name, the Veterans Administration, VA in the U.S. Of course, they have 170 hospitals, and my friend Kurt Fink leads that HTM and CE, and you know. So anyway, all these big guys that need to get together. I know some of your friends in Italy have some big organizations as well. But, so tell us about clinical engineering in Germany. What would stand out? I know you guys have been not only serving your own country, but serving the world for a long time.
Yes, we have. Okay, but so let me just give you a short overview over Germany. I think in Germany we got more or less 2,000 hospitals all over Germany. 30% are public hospitals. 30% more or less 30% are free non-profit, and 40% are private and money making.
No money, no mission, right?
And yeah, so that leads to a roundabout a society or a community of roundabout 4,500 people working in the field of HTM in hospitals. Yeah, this is the framework. The community is not very well established as community. Usually, it's in the main part. It's good working islands who
Yep.
sometimes one times a year when the big congress is looking over what others are doing, and then they dive back in their own business. So it's not like as I see it when I come over to the US and see your meetings. I always like how you work together and exchange information, and you look at the real established community. This is different in Germany.
Well, you know how that works, Frank. When we get it's not during the day when we're talking about professional things. It's at night when we drink beer and other things that we get that going. And I'm sure that's true for you some too. But back to you. Sorry.
Okay, I think it's when we are in our international meetings, I always hear that HTM in other countries is not a very well accepted profession. It is in Germany. We are accepted. Our opinion is heard, but as I already mentioned, 4,500. This is not a large community, so the impact is not very big, but it is notable. So you can yeah. If we say something to legislation, they hear.
Sure.
And follow in some ways our opinion.
So what happened during COVID? Is that, how have you guys contributed and how have you been recognized during this difficult time?
Oh, that was, as far as I noticed, it is usually in hospitals we support it. It is not that we really appear on the screen in Germany, that we appeared in the news or something like that, and the clinical engineers interviewed. But we had a very important role in supporting the special task force in hospitals and hospital chains. And in that case, during COVID-19, the community established a little bit. There were some people taking care for it and trying to implement community work and exchange of experience. That was great. It lowered a little bit down. Now let's see. Now the cases are rising again. Let's see what will happen. Yeah, that's how we dealt with COVID in Germany as clinical engineering. So
Frank, I know I'm part Germanic, but I mean, our people are have a history of innovation, and and of course the home of Siemens, among others, and many other great companies. My point is, how is the whole digital health hitting Germany and healthcare in Germany, from your perspective?
Compared to the US, from my perspective, we're a little bit late. Yeah, you're far further.
Well, we've made some mistakes, but keep going here. we like to fail early,
So if we're talking about digitization, we've recently made an estimation that if you're talking about medical devices, it's around about 10% of the medical devices only that are really connected to IT. That is not much. It's not few, but it's also not much, I think. So we're on a way. And at the moment, the German government is supporting digitization. I think they raised a fund of 5 billion euros for projects in hospitals to digitize them. So it's the topic is in focus, but it's still on its way. Yeah.
Well, will clinical engineers get to be a big part of that? Or do you see a role there?
I think it'll be a necessity to compete with that for us as clinical engineers. We see I don't know how it is in other countries, but in Germany we see that there is there's a change forced in patient treatment from in hospital patients to out hospital patients with just day clinics. They're coming in for day clinics to
Sure.
get their treatments to be.
And the rise of telehealth, perhaps.
Yeah, of course, of course. In following that, you see that big hospitals chains are centralizing their departments like radiology and comparable others. And in this frame, the need for telemedicine is rising because yeah, they want to be economic with their stuff. That means that only one radiologist to do diagnostics on radiographies or something like that is available for 5 or 6 hospitals in an area. So this is an uprising topic in Germany,
Sure.
for sure. Yeah.
So Frank, what would be your closing comments to clinical engineers around the world about our profession?
Oh, that's a tough question. I think in some cases, I think that yeah, when we meet in our international meetings, they appear a little bit shy. I think that clinical engineers should be proud of their profession. They can be proud of their profession, and they should show it, and they should allow themselves an expertise. You see, at least we're all engineers, and we can have expertises like authorities and manufacturers as well. They are not gods. They are it's only an opinion they have, and we have opinions and technical expertise. And so I think we should. Is that English to say we should look them straight in the eyes and not like childs up to their parents?
Right.
And that's what my
That's a good word, Frank.
Yeah.
Well, thank you for your time today.
Okay.
And let's celebrate.
Yeah, let's do that. I hope there'll be a chance to meet face to face again soon.
Well, we'll see you in Orlando at Disney World. Bring the family.
Latestly, I hope, and that yeah, that COVID mess is over soon.
Well, we're all betting on it. So thank you for your time. And bye now.
Goodbye.